Hi everyone. In this clip, I will talk a little bit about Dmso. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please ensure to consult your healthcare provider. So, dimethyl sulfoxide, commonly called Dmso, has been used in the treatment of hundreds of ailments throughout the world. By itself or in combination with other medications, Dmso has proven useful in the treatment of practically every medical problem known. Dmso is a natural chemical compound resulting from trees as a byproduct from the manufacturing of paper. It was first synthesized by a Russian chemist, Alexander Zaitsev, back in 1866. But it is a substance that is totally strange to medical science. Its mode of action is not completely understood, and it is used to treat some ailments that have long been considered untreatable. Also, because of its distinctive garlic odor, it's very difficult to conduct double-blind studies with Dmso. However, it's always possible to have studies involving Dmso where the results are compared to the current treatment. Pardon me. As an example, if a disease at a certain stage has an expected mortality rate of 80% within 1 year, and there's a 10% mortality rate for those treated with Dmso, it shows that Dmso is a successful treatment. If the mortality rate stays at 80% range, then it shows no improvement, right? So some of you also have heard of methyl sulfonylmethane, which is commonly known as MSM, and this is a product that is derived from Dmso. MSM has many of the properties of Dmso, but it is generally regarded as a food supplement. Dmso is one of the most powerful free radical scavengers known. Free radicals are unstable charged molecular fragments that attack other molecules, causing severe damage to cells throughout the body. This disrupts the normal functioning of various organs. Free radical damage is usually slow and accumulates over the years. Eventually, this can lead to such ailments as the big C and arthritis. It also leads to premature aging. It's possible that the regular use of Dmso may completely prevent some serious ailments. Another important action of Dmso is its immune normalizing effect. This makes Dmso important in the treatment of autoimmune diseases and can also help the natural immune system fight off various infections and contagious ailments. Now, Dmso also passes through the skin and other cellular membranes of the body. This is the reason that the application of a small amount of Dmso applied sort of topically to the skin can cause a garlic-like breath odor. Now, this is one of the few products that are also able to cross the blood-brain barrier. It's also able to take other products that normally do not cross the barrier with it. This could make Dmso valuable in the treatment of many brain problems. Now, another important action is that it is a vasodilator. This can increase blood flow, allowing blood to more easily reach areas where damage may have happened or occurred. In brief, some of the areas they have successfully used Dmso are Alzheimer's and dementia and other kinds of dementia. Dmso has been shown to dissolve amyloids, the protein that occurs in the brain lesions of patients with Alzheimer's, and treatment should be started as soon as major decline is noted in the patient. Improvement is more dramatic with early stage patients, of course. It's used in arthritis through injections of Dmso. Usually 5 cc's of Dmso were used along with B complex, vitamin C, and magnesium sulfate. An infusion was given 2 times a week for 5 weeks, then once a month for 18 months, or direct application to the affected area, especially if the cream is also mixed with cayenne pepper, as well as drinking a 1 teaspoonful every day in 4 ounces of juice. Some patients have said that they feel better if they combine the Dmso with glucosamine sulfate. Others prefer to combine Dmso with MSM. It's also used for athletic injuries as well as prevention of them, and also brain injuries, which needs to be used immediately after the injury through slow drip method, up to 5 grams per kilogram of the body weight, and after 24 hours the dosage is reduced to 2 grams per kilogram of body weight. Even though this is the most effective form, Dmso can also be applied directly to the head externally. Water can also accumulate in the brain, causing pressure on vital parts of the brain. Dmso is the best product available to remove the excess water. Burns is another area of use. Use of lotion containing 50% Dmso and 50% aloe vera is good for that. For the big C treatments, when Dmso was given in low dose in drinking water along with a low dose of cyclophosphamide, there was strong anti-cancer activity without the lowered white blood cell count. Usually intravenous slow drip injections of 4 milligram per kilogram of body weight of cyclophosphamide dissolved in 1 milligram per kilogram of body weight of Dmso is given in a normal saline solution 4 times a week up to 6 weeks. This is of course a lengthy subject, as Dmso can be combined with many medications for slow drip. Now, just to quickly sort of touch upon other issues that Dmso is used to treat, there are carpal tunnel syndrome, liver cirrhosis, diabetes, digestive problems, hearing problems and ear issues in general, eye problems, fibromyalgia, fungal infections, teeth and gum issues, hair and scalp problems, headaches, infections, inflammation, lupus, mental illness, MS, shingles and herpes, spinal cord injuries, and a whole lot more. Now, Dmso has long been considered to be one of the safest products ever used in medicine. There have been no documented cases of death or serious injury from the use of Dmso, even though millions of people have used it in the United States and other countries around the world. Dmso is made in 3 different grades. There's industrial, veterinary, and medical. Medical grade Dmso is the highest quality to be used, basically. So we need to know that Dmso does have interactions with medications and can sometimes increase how much medicine in the body is absorbed. This might increase the effects and side effects of the medicine. So Dmso might slow blood clotting, so taking Dmso along with blood thinners might increase the risk of bruising and bleeding. It comes in the forms of cream, liquid, or powder form, liquid being the most popular, of course. And there's a lot of information available on this topic, and I encourage you to have a look. Hope this has been helpful. Like and follow for more. Be the light.